to the India Development Debate. I'm Tamanna Inamdar, and what a manic Monday it has been, especially for the markets, spooked by the global markets fear and news coming from all quarters, fears of a second wave in the US, in China, with bad news from Beijing over the weekend, and that impact was seen in our markets as well. We're going to be talking about the markets a little bit ahead in the show, but we're also talking about testing. Now, in the context of Delhi, at the end of an all-party meet, it has been decided that testing will be ramped up, and a promise has been made that everybody who needs will get a test. This is the call of the hour, not just for Delhi, not just for Mumbai, but across the country. We're going to take a deep dive into why we have been lagging behind in testing with some of the best medical voices that are out there. So stay tuned for that as well. But first, let's shift focus to the markets. And it was mayhem, a manic Monday with major indices all below 1%. The bank Nifty suffering the most. A lot of it global news, some of it profit booking. But let's go across to markets editor and, of course, managing editor Nikunj Dalmia for more on this. Nikunj, what's your sense? What is the reason why we've seen this kind of mayhem today in the markets?
We can put a variety of factors out to justify last couple of days where markets have been volatile. And the factors are the obvious one, fear of a second wave of coronavirus, routine profit booking after the monster rally which we've seen in the month of May and June, or concerns about valuations. I would say markets were due for a correction, and the entire medical news update on coronavirus and fear of a second wave, it may be scary, but markets are using that as an excuse to really turn volatile. The challenge for this market is that economy is here and markets are here. And the reason why markets are completely disconnected with economy is because of liquidity. Everyone is convinced that Fed has got the backstop for this market, and every time markets will go down, the Fed will start their printing machinery once again. Now, with that kind of confidence, markets rallied smartly in the month of May and then became euphoric in the month of June. And things were looking due for a correction. Now, where do we go from here? I think that's the tricky part. There is no easy answer in the short term because there are a lot of moving parts. First, medical news. Second, economy. Third, earnings. And fourth, liquidity. If you combine all these factors together, one would argue that we may not be in for some kind of a V-shaped rally from here. Similarly, we may not be in for a crash landing like what we saw in the month of March, because markets, they never react to the same news twice.
So what's the outlook like, Nikunj? Are we seeing, more days of pain up ahead, more consolidation coming in?
Like I said, in the short term, you would imagine that this market should settle into a consolidation phase. Now, whether it is 9,500 to 10,000 in the Nifty or 9,000 to 9,500 on the Nifty, that's anyone's guess. But looking at the current set of circumstances, the fact that bulls are out of the hibernation, bears will have to really drop something new or unreal for markets to go back to March lows. So you have to work with an assumption that it was a rising tide which took the markets higher in the month of May and June, and now it's going to be a very differentiated tide, which is that not all stocks will go higher. Stocks which deserve to go higher will only go higher. Let's say if you bought a haystack in the month of May, you made money. But now you cannot bet on the haystack, you have to find the sharp needles from the haystack. So I expect markets to consolidate, markets to become very stock specific, and see between the laggards and the losers now, the gap I think is only going to increase.
Well, thank you for that, Nikunj Dalmia, with all that market perspective. So you have to keep an eye out on markets, and of course the best place to do that is ET Now.
Testing. We've heard that pretty much from day one of the entire COVID-19 pandemic, that the only way for any nation, any authority to battle COVID is first to know what the true and full picture is. Now, testing has been a controversial subject in the Indian context right from day one. And today it's come to the fore once again because of what is going on in the national capital, Delhi. So Home Minister Amit Shah held an all-party meeting today to talk about what to do about the numbers in Delhi, which are growing exponentially. You've had about 2,000 positive numbers per day over the last few days. There are stories about shortages of beds, etc. But one key takeaway was a promise at the end of it all that there would be testing available for everyone. There's also a promise that Delhi's testing will be ramped up to 18,000 per day from June 19th. Remember, it's about 7,000 per day right now. So how is this going to happen? Why has it not happened so far in other places? And I'm talking about Delhi, Mumbai. People are asking that question in Hyderabad, all over the country, really. Why has there been this sort of hesitation to test? Is it because numbers of those who are positive has become a political issue in our country? So every authority sort of wants those numbers to be less, and there seems to be a gruesome logic to this. Less testing equals to less numbers equals to we've tackled the problem. But that's not really the case, as we are unfortunately saying. So today we're going to talk about how we need to ramp up testing and what the problem really is. Speaking to me on this today is Dr. Shashank Joshi, postdoc doctor with Leelavati Hospital, and very importantly on a special task force put together by the Maharashtra government. Dr. Arvind Kumar, chairman of Gangaram Hospital. I'm also speaking with Dr. Velumani, chairman of Thyrocare. Welcome to all of you. And thank you so much for joining us on this show today. Dr. Arvind Kumar, I'm going to start with you because, you know, the whole focus of everyone is on Delhi. Though I honestly believe this is an issue which is beyond Delhi, that we aren't testing enough. Tell me, is it really going to be possible to increase the amount of testing in such a short time? And if it is, why weren't we doing it so far?
Tamanna, that's a very good question. So as far as your first part, is it going to be possible to increase? The answer is a simple yes, because there are a huge number of laboratories which are available, which are equipped to be able to test it. Up till now, their capacity had not been utilized. And regarding the second part, why it has not been done to take decisions, why they did not take this decision till now. But as you mentioned in your introductory remarks, that definitely there has been an across the country effort at keeping the testing numbers low, because if you test less, you detect less, so your numbers remain low. And that, you know, that shows that you're doing well. Whereas if you test very high numbers, as US is doing amongst one of the highest testing, you will detect more and you will be showing more numbers. But I think from a pandemic perspective and from control of pandemic perspective, the strategy is not to test less. The strategy should be to test, because it is only when you test a large sample of the population that you not only detect the symptomatic but also the asymptomatic carriers who may be asymptomatic but are equally dangerous as far as spread of the disease is concerned. You test them, detect them, isolate them, quarantine their contacts, and this is how you break the chain of transmission. So the need of the hour is to ramp up the testing as much as we can across the country. That will be the best situation for the country. Tamanna.
No, but the fact is that the guidelines for testing are still very stringent. Dr. Shashank Joshi, you know, very keen to hear from you. And remember, the story of Dharavi is being celebrated everywhere as a success story. Dr. Joshi has had a lot to do with it, worked very closely with it. Why have we held back on testing when private labs have been allowed to test? Because it all comes down to a doctor, you know, saying that you need to be tested. And we know that doctors have that pressure on them. There are completely stringent measures that allow a doctor to even certify someone to be tested.
So I think first thing, Tamanna, let me be very clear. I completely agree with Dr. Arvind Kumar that we need to test. So that and particularly in a red hotspot like Delhi, Mumbai, Ahmedabad, and many such like Chennai, we need to test more. There's no question asked about it. Now it is the equation who is allowed to test. Right now, we are governed by an ICMR guidance, which says all symptomatics need to be tested and asymptomatic contacts need to be tested. Now, whenever there is a pandemic, how do you attack the pandemic? Through a public health strategy, because we are looking at India as large. We can't test 1.3 billion people. That's a given. But in all the containment zones, in all the red zones, we need to aggressively test, aggressively trace the contacts and isolate and quarantine. If we do this, look at Singapore, look at Taiwan, look at Hong Kong, look at even a country like Thailand and Korea. Look at their strategies. How did they conquer this pandemic? They conquered the pandemic through aggressive testing, aggressive contact tracing. We have a very good Arogya Setu app, which we need to download, but the app is only going to be valid if you test. So if you don't test, it's going to be a rate limiting step. Now also remember that testing needs to be ramped up, no question asked. Initially, there was a challenge because the number of testing centers were less. Now I think we have upscaled them tremendously, and we have people like Dr. Velumani who are actually can upscale it.
How much are we testing, for example, in Mumbai? The figures I have seen is we're testing about 4,500 a day when we have a capacity of 10,000. Why?
Absolutely.
We had to wait till very recently for guidelines to allow asymptomatic relatives of someone who's COVID positive to get tested. Before that, we had to have symptoms first.
All asymptomatic contacts of not just relative, all asymptomatic contacts of a positive case of high risk must be tested. I'm saying must, I'm not even saying maybe. If they are low risk or moderate risk and they are a contact, they should preferably be tested. So I'm very clear that when you are handling a pandemic, when you want to get your numbers right, when you want to save people's lives, you must be very focused. So there are two testing strategies. One is a symptom-based strategy and one is a test-based strategy. When you have got capacity to upscale, we should test, and tests should be optimally utilized, both in public and private sector. And I think now a lot better ability is there for people like us to test. But this definitely needs to be ramped up. There is no question asked about it. So it's a no-brainer that we are testing less and we need to test more. But beyond testing, also remember, Tamanna, every positive test needs to be aggressively traced and isolated and quarantined. If the second step and third step is not done correctly, you are again going to fail. So in that whole chain, if you want to contain and get better numbers for Mumbai, get a better doubling time, like Dharavi has a doubling time now crossing 30 days, it can only be possible by aggressive testing, tracing and quarantining.
Okay, Dr. Velumani, the question is, where are we stuck in the testing loop? Now, when the whole COVID-19 pandemic situation came before us and they allowed private labs to test, mostly in large parts of the country, it was at least a heave of sigh of relief because there was an option. Now, over the weekend, we've seen prices being capped in certain places for private testing between 2,200 and 2,800. So it's become cheaper. ICMR today talks about a test which could be as low as 450 rupees a test. Will this make it easier? Has the whole process been very difficult so far?
So let us approach the testing angle from 3 points. Number one is quality. Number two is cost, and number three is the target. So quality wise is an absolutely wonderful technology. Positive is positive, negative is negative. Technology wise there is no challenge, but if you want to block a laboratory doing testing, you can block it by telling last week it was positive, this week it is negative, and you are having poor quality. And all laboratories across the country have been shown quality as an issue to block. Obviously, blocking reduces the testing and the testing reduces the positivity, and positivity less is comfort. So I believe that was one of the motive to tell quality is poor. Number two, cost. I think cost is a parameter. Cost decides the volume, and today the costs are brought down. Cost bringing down will increase the volume, and volumes will justify the business, and that is not an issue. They have done it, but perfectly all right. Target is the issue. It's not democratically tested. No patient can get it tested if he wants, even if he is very rich. No doctor, however big a consultant he is, his recommendations are not accepted. It is routed through the local administration, which administration is controlling it. So there is no consumption democratically. So the numbers which we are seeing as number infected and the deaths per million all appear to be decided based upon tests not done. That means the numbers could be not true numbers, both infected and the dead. So if you ask me, there is no block in the capacity. My laboratory has a 5,000 capacity. We are only doing 1,000 because many municipalities have told us don't pick up specimen in my area. So this is the big. Yeah.
No. So the long and short of it is that local administrations want to suppress the numbers. Let's be honest about it.
I won't be able to tell it, but they have the necessity to control the epidemic. If they feel this is the way of controlling, they are probably not right.
No, but if I want to solve a problem, I don't close my eyes.
But then, every state is also cutting down the numbers so that they feel they are better administrators. We have to go through it. We cannot sit around and escape from it. If today Dharavi is seeing comfortable, it has gone through it. Every city has to go through, every state has to go through. I don't think by delaying, by avoiding, we are doing any good for the pandemic control.
Yeah, absolutely. So I want to understand now how this will happen and where can we ramp up? Because after testing, like you said, Dr. Joshi, the next step is to actually treat and isolate. Is the fear that our medical infrastructure capabilities are not large enough to, handle the true numbers if we test everyone?
So I think to a great extent, originally that thought was true. But now I think we have done two things. One is that asymptomatic, pre-symptomatics can get home quarantined and manage them at home. And I think at least in Mumbai city, I can say for Mumbai city, they have built these field hospitals, which are now getting functional with almost 4,000 or 5,000 capacity. So once those hospitals are in place, I think apart from Wuhan, Mumbai is the only city which has built this 1,000 bedded each field hospital. And we need to optimally utilize them so that at least that bed and the online dashboard which is available, the problems which we had in the probably 15 days back or 1 month back, it used to be a nightmare. Most of us were trying to get beds for our patients. At least that has come down. But I completely agree with you that we need to upgrade and upscale our healthcare facilities. The lockdown has given us sufficient time to upgrade it. At least Mumbai, I would say, to a great extent has made an effort in that direction because, but still our shortage is ICU beds. ICU beds are woefully short. And still they are trying their best to upscale it, but to create ICU beds is a challenge. And that still remains a challenge. Oxygen will be in short supply. Oxygen will still be a challenge. And I'm sure Dr. Arvind Kumar will be able to tell you with his knowledge in pulmonary medicine, the problems in Delhi.
As I understand, oxygen and ICU beds are required for a much smaller proportion of those who are COVID-19 positive. So imagine the total numbers then, Dr.
No. Ventilators are less required. Nasal, prone ventilation and oxygen is required in large numbers. Let me be very clear about that. Okay. Ventilator numbers which were projected in the past, that number might have gone down, but he's an expert with us in the lung medicine field. He'll be a better position to tell. Yes. And Delhi definitely, I think, has a challenge with capacity. Bombay has partially overcome it. Delhi actually has a lot more to do.
So Dr. Kumar, Delhi is where Mumbai was a couple of weeks ago?
Yeah. So we are now in the steep rising curve where every day the number of cases are increasing. At present, the reported number is 2,000, but I'm sure that the actual number of new infections occurring every day is many times more. And obviously, now let me clarify what happens to these patients. So typically, reports say that about 85% of the patients about 80 to 85% of the patients will have a mild disease in which they'll have fever, sore throat, cough, myalgias, loss of taste, loss of smell, diarrhea, these kind of symptoms. But they usually do not develop breathlessness and they can be very well managed at home with fluids, rest, medicines to control fever, and symptomatic treatment for sore throat and cough, etc. The remaining 15% will have lung involvement, which typically presents around 5th, 6th, 7th day. And these are the people who first and foremost need oxygen. Now, there is one very funny thing which is happening, and it's a very serious thing. There's something called happy hypoxia or asymptomatic hypoxia. Typically, when our oxygen levels fall, we immediately start feeling breathless. But due to some not yet understood reason, these patients, even when their oxygen levels have fallen to say 80, 75, they are not experiencing breathlessness. So that hypoxia is sometimes going undetected. So that is why a large number of people are now being told that when you are managing a patient at home, please keep a pulse oximeter, keep checking your pulse. Anytime on room air, if your saturation goes below 95, rush to the hospital or arrange hospital oxygen at home. You need oxygen. Now, and less than 5% will need to. So these 10% do not go to ICU. They go to hospital, but hospital oxygen bed, not ICU. It's only about 5%.
My question is that why should not someone who has a sore throat, a fever, a running nose, not have the option to test?
No,
they may come out negative. Why should they not be able to know at this point in where we are with COVID?
Tamanna, this is an issue on which all three of us unambiguously said that this should be the right of the clinician to decide whether this patient needs a test or not. I accept the role of ICMR as a policy laying down, guideline giving body, but it can't be a statutory guideline that you can't move 1 millimeter this way, that way. You are actually taking away the basic right from the thousands of clinicians across the country who are managing the patient on the ground. If I see a patient and after seeing him, I decide that he needs a testing, he should be able to have a testing done. I 100% agree, and both of my panelists have said the same thing unambiguously.
I want to take it a little broader. We've been talking, and a lot of the focus of the media has been on Mumbai, Delhi. They are your big urban centers, so more cases. But now as we move along and, as an impact perhaps of the migration we've seen also, the fear is that what happens when cases start to build up outside the major cities? And then what happens to the capabilities we have there? Dr. Joshi, you want to talk about, how we need to prepare for that as well? Because sometimes we get very myopic with looking just at Mumbai and Delhi.
So remember, locking is a science, but unlocking is an art. And unlocking has to be mindful, cautious, careful, and appropriate. It cannot be reckless and completely dominated by myopic vision. It needs a very sensible, logical approach. So if there are people who have come in any geography which is green, they need to be contained and quarantined for 14 days. If they have any symptoms, they need to be tested on time and tested appropriately with their context. That's number one. The second is the oranges. We have a lot of orange spots in the country. They cannot become red. They have to actually become green. Again, you need a very aggressive testing, tracing, contact tracing, and isolation policy. See, ultimately, Tamanna, it all boils to testing, tracing, isolation. If we get that number right, and people's will is equally important. What is the people's will? Simple SMS. SMS means soap or sanitizer, mask, which is mandatory. Masking is absolutely mandatory. And third is social distancing. So if somebody is in the public domain, independent on where you are staying, people need to do SMS, which is soap, sanitizer, masking and distancing. And authorities, it is, I feel, mandatory for every collector of the country to ensure that the testing, tracing and isolation protocol is absolutely in place. You cannot compromise on that, particularly now when we are going to see transportation and people migrating for whatever reasons it may be.
So give me an idea of the testing capabilities. Dr. Velumani, give me an idea of the testing capabilities outside your large urban centers. And remember, you still have cities in the country where they're not allowing private labs to test.
But Tamanna, with airlines working, any part of the country can be tested and reported even from metro cities by 24 to 36 hours period. So testing takes only 6-7 hours. So it's not that it is only that district town of Dhanbad need to have one center with capacity there. So that is logistics issue that can be very well addressed too. Whenever I am looking at the entire scenario, government did not prescribe the states to do what percentage of population they must screen. This is not put to the state. Now, trust me, millions per death for India will be more or less same whether they are in cities or whether they are in small towns. So you have to create bed capacity to handle that many millions per death. Sorry, deaths per million. You have to have a capacity. We have finished 75 days and today we have no capacity. All these years we should have created a capacity. It is not too late for rural India, for tier 2 towns, tier 3 towns. You will have to have that size of availability of bed to handle that many deaths. Deaths you just can't prevent. Delay of infection you can do. Delay of informing the number of infected you can delay. But if without facility, you will suffocate the rural India as much as Delhi and Mumbai are suffocating in this last 15 days.
Yeah, I must, before we wrap, I must touch upon another very important aspect of the whole issue. And of course, testing is one of them. We've spoken about it in detail. The other is the cost of treatment. And let me come back to you, Dr. Arvind Kumar, because in Delhi and over the weekend, we saw this sort of table of prices, which, was being circulated everywhere. Then there was some clarifications, etc. Now we know that in this all-party meet today, there has been a talk about bringing costs of treatment lower. On the other hand, private hospitals are, in a quandary. They're saying we're finding it difficult to even run with the situation. We have some cases in some hospitals where doctors are not getting paid. Now, how do we make this formula work? Because even now, unless, a patient is going to a government hospital or completely at the mercy of, the government taking care of their treatment, it's something a lot of people just can't afford.
So Tamanna, I think the government needs to have a very pragmatic approach of utilizing 100% of the available resources in a most efficient manner. Let me give you an example. Couple of days back, when some of the private hospitals were being accused, at the same time, when we looked at the app, we realized that out of nearly 5,000 bed capacity in the government-run hospitals, Delhi government-run, 70% of the free beds, which are free, 70% of the beds were vacant. And in the private sector, if you go, or you go to places like AIIMS and Safdarjung, you find that 99% of the beds are occupied. So first thing that we need to check is, why are 70% of these free beds not being taken by people? Why are we people going to the other hospital? And the answer came in a video which we got the next day, because of the problems in the ward. So first thing is, we need to, whether it needs money, whether it needs manpower support, we need to utilize our available resources very effectively in the government sector. That's point number one. The point number two is, private sector hospitals are not supported by government. Treating these patients is an expensive proposition because of all kinds of barriers, PPEs, sanitizers, your staff. About 10 to 20% of staff in various hospitals is falling sick. When they fall sick, they need to be looked after by the hospital, but they are not working. So, there is cost to the hospital, but they are not working. All this adds up to the cost. The need of the hour is not for pointing accusing fingers. I think the political leadership and the leadership of government and private hospitals, all of them need to sit together and work out a plan where we make the most efficient and most effective use of beds in a manner that every citizen of our country can have access. If they want to go to government hospital, they go there. If they have little more money to pay, they go to private. But nobody should be denied the treatment for want of money.
It's not even just want of money anymore. The fact is that, everyone has to think of what connections they have. There was an excellent story recently in the Economic Times which talked about top babus in the capital trying to figure out how to get a bed. Dr. Joshi, the well-heeled in Mumbai also don't really know what strings to pull for a hospital bed for a test. And that's the sad fact of the situation. So what happens to the Aam Aadmi?
So I think I completely agree with Dr. Arvind Kumar that this is one time when we are at war. And you will agree with me that we are at war with this virus. And we need excellent cooperation of private and public sector. I think private sector has come out, but for them, it is like a zero-sum game. It is necessary that public and private sector work together in unison in this war, taking people into confidence. There is attrition both in public hospitals and private hospitals. Yes, in Mumbai, these problems were there a month back, but I think things have got much, much better now. And I think I endorse one thing with Dr. Arvind Kumar said, no patient should be denied a bed. No patient should be denied oxygen. And I think with these field hospitals coming in Mumbai, it is giving us breathing space. See, the point is that panic which goes into a mind when the test comes positive. First thing what you need is counseling.
Counseling.
And second thing is many people who want a bed actually are asymptomatic. They don't have comorbidities. So we need to filter them. We need to counsel them. We need to allay their anxiety and then appropriately give based on their affordability, appropriate bed. I think this needs a war room. This needs a 24/7 dash line. It needs transparency and it needs a little more accommodative feeling from all sides. I think now we are getting there. It's taken us time. Let me be very honest. There were a lot of teething troubles. It has taken us time. And I'm very positive about Delhi also that ultimately maturity will prevail. And see, in any pandemic and war, there is panic. But now I think in Mumbai has passed that panic and peak both. And I think we are getting a little more mature in the pandemic. I think Delhi is going through that phase and we wish that they are able to handle it better. I think even Mumbai still has its teething problem for an occasional bed. As I'm talking to you right now, I'm getting phone calls to get a bed for somebody. So it's a routine and it's very difficult sometimes. Trust me, hospitals are blocked. You know the second problem? Discharging patients out. Once they get in, to get the patient out, it's like a clog. It's like a traffic jam. So to move the patient, and I'm sure Dr. Arvind Kumar has the same problem in Delhi also. Sure. Once you are asymptomatic for 3 days, formally we needed 2 tests. Fortunately, ICMR removed that policy of doing 2 tests because we know after 10 days the virus becomes non-replicative. At least now we can move the patient, if not home, we can move them to a corona care facility and free up the bed for a deserving patient. So just like entry is difficult, exit becomes difficult. Societies in Mumbai, they were not ready to accept a patient because they think that without a corona negative report, we can't accept the patient. At least for them, if the test has to be done, that privilege should be with the doctor so that the patient can go back to the society.
Allow the doctor to decide. Allow the doctor to decide when to test. Let's not start celebrations about any city yet.
No.
These are very
we are far away. Mumbai is also far away from celebrations. I'm sure Dr. Velumani will tell.
Around the world, it's second waves coming in. We have to make sure that we're on top of the game, but keeping your eyes wide open is the least you can do. You cannot solve a problem with your eyes shut, waiting for it to go away. Testing less is actually equivalent to that. With that, I want to thank all of you for speaking on the show. 3 excellent medical voices. They're breaking it down with complete frankness. Thank you. Thank you for joining us today.
We'll take a very short break at this point, but when we come back, we're looking at, maximum city Mumbai, which is going to now see trains restarting, but in very small proportion. What about the rest? Can the city really unlock without public transport coming back to where it needs to be? That and a lot more after the break.